Hello, I'm Dr. Charles Chu, an infectious diseases physician, microbiologist, and professor of laboratory medicine here at University of California, San Francisco. There is an urgent need for rapid, simple, yet accurate tests to detect SARS-CoV-2 and diagnose COVID-19 disease. Our resources for testing symptomatic patients are still limited. In addition, we currently lack the capacity to mass screen asymptomatic people for return to work or school, or to conduct population-level surveillance that is essential for public health containment efforts. Moreover, the recent emergence of SARS-CoV-2 variants that I and others have been hunting for further justifies the need for rapid testing at a highly massive scale to both reduce transmission and lessen the chances of virus mutating within the human host. This can be made possible with a decentralized testing solution that can be performed outside of a laboratory. Thus, we must focus our efforts on point of care and even at-home settings with easy-to-use, portable, low-cost, and disposable testing solutions. When the pandemic started, my team collaborated with Dr. Adam Abate's group to develop rapid diagnostic tests for COVID-19. The synergy between our groups and our combined expertise enabled us to develop workable solutions in just a few months. My laboratory at UCSF was one of the first to obtain FDA emergency use authorization for a CRISPR-based COVID-19 diagnostic test. Our solution to address the XPRIZE challenge is titled SARS-CoV2home, abbreviated UCSF CoV2home, a portable loop-mediated isothermal amplification or LAMP assay that can detect SARS-CoV-2 from clinical samples in approximately 1 hour. The key advantage of our assay lies in the fact that it is a nucleic acid-based molecular test, utilizing a lateral flow strip as a visual readout. This provides simplicity without sacrificing assay sensitivity and specificity. The majority of COVID-19 at-home tests currently available are either antigen-based lateral flow assays that may be less accurate, or merely collection kits that are shipped to larger reference clinical laboratories for testing. Our solution is an RNA-based diagnostic test that can be run by virtually anyone. This assay is as simple as can be. Just insert a nasal or saliva swab into the cartridge inlet where lysis will occur in a few minutes, close the device, and the assay will start. After about an hour, the result can be read visually using a lateral flow strip incorporated in the device, the same kind of strip that is used in ubiquitous home pregnancy tests. Notably, this assay has been thoroughly validated in the laboratory, and performance has been outstanding, with an analytical limit of detection down to 4 copies of viral RNA per reaction. The key advantages of our assay lie in its accuracy with sensitivity and specificity comparable to gold standard RT-PCR, speed, a less than 1 hour solution, low cost at under $15 per test, compatibility with both nasal swabs and saliva, and simplicity, with immediate readout using lateral flow strips. By providing a decentralized testing solution that can be deployed at a massive scale in point-of-care settings, such as a doctor's office or emergency department, or even at home, we will mitigate or even prevent future waves of COVID-19 infection that will ultimately save thousands of lives. Thanks for listening.
I'm Adam Abate, a professor at UCSF in bioengineering. Charles and I have collaborated on a number of advanced research projects over the years. Our COVID collaboration began when the pandemic started with a simple but ambitious goal to enable accurate molecular testing for the virus at home by anybody. Molecular testing detects the nucleic acids of the virus and is the most accurate format available, but it's a tough nut to crack in the at-home setting due to its complexity. To make our vision a reality, a number of hurdles had to be overcome, especially eliminating all workflow steps commonly conducted by trained laboratory personnel. Moreover, this had to be done by a fully automated device costing under $15 a test. The eureka moment came when we realized that our precision LAMP assay could be automated on a disposable microfluidic chip that would require nothing more from the patient than to apply their sample and initiate the test. In addition to simplicity, our test matches the sensitivity of gold standard laboratory tests based on qPCR. Accuracy is critical because it enables confident test results, especially compared to the competing tests based on antigen detection. This preserves precious testing and hospital resources that are already strained to the limit and lessens the burden on the individual and their family, friends, and coworkers. The bottom line is that our test is simple, accurate, and cost-effective, and with vaccination efforts will speed the return to normalcy.